Dr. Bernhards Ogutu. I work with the Kenya Medical Research Institute. I'm a pediatrician by training, and also my area of interest is developing products for the care of children. That is both drugs, vaccines, and diagnostics, and taking part in building capacity of those who are involved in the care of children and doing research in pediatric illnesses. We are going to take stock of what is happening around this, one of the very serious but neglected diseases across the world, and that's sickle cell disease, which affects quite a big number of people within the African subcontinent. This is a disease that predominantly affects people with the African heritage and those from around the Mediterranean Sea and around the Middle East region. That's where we find the disease most prevalent. This is a disease that is inherited from a parent to a child because of an abnormality in the genes that code for one important protein that helps in transporting oxygen, which is found in the red blood cells. And that's the abnormality that happens in those proteins that makes them to start to basically clamp together when they are exposed to low oxygen tension in the body. And that's what results in the cells becoming sickled or having a shape of a sickle, and that's where the name comes from. This definitive cure is only by bone marrow transplant, which most patients cannot have access to. And the bone marrow transplant is a specialized treatment that the process of doing it is also rife with more complications, so not many patients can access the ultimate cure. There are new modalities that are coming up, like genetic manipulations, what we commonly call gene editing, that soon we'll see whether that is going to be a fairly useful tool that can provide a true cure. Apart from that, most of the drugs that are currently being used and other interventions are those that help modify the disease so that people with sickle cell can have a better quality of life and can continue with their lives and also live to adulthood like everybody else. But they are not definitive cure as such. There have been several misconceptions and several false beliefs around what causes sickle cell. And as I said, it's a disorder in the genes of people who develop this disease. And it is not linked to any bad omen, as people might have thought. And this is one of the things that has caused quite a lot of problem in a number of people, that you want to think that it is related to something else and not what we already know. And this is what we need to demystify by ensuring that most people know their status of sickle cell in areas where this disease is common. And I think it's just because we have not put systems in place to make sure that people get diagnosed and they know their status early, so that they can know those who are likely to have children with a problem who are carriers, so that they can seek help earlier. And because the children tend to present within the first 6 to 9 months of life, and usually the presentations are not very specific. They might be the blood level goes down, they might have swelling of the feet and the hands, and these are some of the things that possibly needs to be picked, and also train our medical personnel so that they can be well aware of these conditions and pick them early enough before the children develop many problems. This is a disease that has been fairly neglected from the time it was first reported in literature, which is almost 100 years ago. And it took another 40 years before people determined what really was behind the events that we see with sickle cell disease. In KEMRI, there has been quite a lot of work trying to map out and know the extent of the disease in Kenya, which has led to quite a number of information being available to inform what needs to be done. And some of these abnormalities, like sickle cell disease, tends to occur with other abnormalities in the red cells in the body. And when those abnormalities come together, the way they present sometimes is different, is a bit modified. And these are some of the things that we've more or less been able to really characterized within the research going on in KEMRI, both in Kilifi and in Western Kenya. And this has helped us really understand the magnitude of the disease we have, what are the variations and the different presentations that we have. With that, in KEMRI, we have also been involved in the recent past now in trying to evaluate new treatment products that are currently being developed by other partners, and we are getting involved in that to see whether they can be useful for the population in Kenya. And we are running almost 6-8 studies on testing new treatments for sickle cell, so that we know whether they are good for our population before we start seeing what do we need to implement. We are currently also working with the Minister of Health and other stakeholders to develop the newly developed guidelines for treatment and management of sickle cell in Kenya, which I think are going to be launched in a short while, so that people can have the same protocols that they use across the country. And apart from that, we are also involved in trying to be part of the networks across Africa to bring in all the countries that have this problem, so that we can understand the magnitude of disease across the region, so that we can develop new ways and modalities of managing the disease, not just in Kenya, but what cuts across the other countries, so that we know what is happening everywhere. And with that scale of activities, we should be able to start developing access programs that will allow those who are with sickle cell to access some of the new treatments that will be coming up. I would not call this a celebration of sickle cell on this day, but it's a day to take stock. What have we done? What do we need to do? And where are we in providing care for this neglected population, because they have not had many products to support the cure for a disease that is really debilitating many families and leaves many families quite in a bad economic status. So we need to know where we are, so that we can bring everybody on board to provide solutions to make the life of those who are living with sickle cell disease, and also those communities that possibly are likely to have people with sickle cell disease, reduce the burden. Because if we do diagnosis properly and we diagnose everybody, then we can be able to start telling the younger people what decisions they need to make when they are planning to get married, so that they don't end up with children with sickle cell. And that's one of the key things that we need to drive home, so that we reduce the burden, but we can have careers within the community. To those who might have children with sickle cell, is that this is a disease that can be managed. Out in other countries, in Europe and America, people are living to adulthood. Children need not die within the first few years of life. Get them early to be diagnosed and enroll them into the treatment programs that are available, so that they can be followed up, can be supported, and they can grow to adulthood. And also, this is not a curse. Is a disease, and there are treatment modalities available. Please get to the nearest health facility, and if you don't know anybody, ask and be referred to appropriate health facility or appropriate professionals, which are currently now available in most of our counties or within next to other counties, that we can get help and possibly get treatment. And now we are involved in a number of research activities to improve the knowledge and also bring new cures. Please be ready to participate in these new research activities, so that we can get real cures for our populations, and also ensure that the products that we are going to research on and we are going to release and get registered for use are really good for our population. And we can only be certain of that if our population participates in these research activities.